many terminally ill patients, the wait for drug approval can be the difference between life and death. Good evening, I'm Brynne.
And I'm Jim Neely. Thanks for joining us today. A Missouri Legislative Committee met to talk about a bill that would make experimental drugs available before FDA approval. KOMU8's Brynne Whittaker is here in the studio to tell us what the bill could mean for patients with fatal diseases.
Right now, terminally ill patients in Missouri can take part in experimental clinical trials, but only about 3% of people who apply for the trials get picked. The Right to Try Act discussed today could make the drugs from the trials available to all patients that consent, not just those chosen for trials. The drugs would need to pass a basic safety test before being administered to patients. Proponents of the bill say the reform gives people the right to try unapproved drugs without being picked for a trial.
It was a family that had two boys that have muscular dystrophy, Duchenne's muscular dystrophy, and one boy's in the trial and is doing better. The other boy is out. He's not in the trial, not doing as well. I can only imagine what that family is thinking.
Neely went on to say no one voiced opposition to the bill in the Legislative Committee hearing today. Opponents of the bill say it could give false hope to those given a fatal prognosis. Right now, a similar bill is being discussed in Colorado, Louisiana, and Arizona.